All right, dear listeners, my name is Vladimir Kosonogov. I'm a PhD in neuroscience and a research fellow in Institute for Cognitive Neurosciences in HCC University in Moscow. And in general, my topic is emotions, all physiology related to emotions, but in general, vegetative indicators of emotions like skin, heart, breath. And also I have some experience with EEG and magnetoencephalography, which I'm not going to present today, but if you have questions about brain mechanisms of emotions, we also can discuss it as well if you need it. First of all, I would like to ask you to raise your questions immediately if you have some doubts. I mean, not delay the questions till the end, but ask them immediately. It will be more comfortable. All right. So first of all, let's briefly overview the theory of emotions. Let's say theoretical frameworks that are popular now, or in other words, approaches to studying emotions. And in general, I would call that emotion is a brief, immediate response, very short and very strong response, brain response and bodily response to a sudden stimulus. It can be an external stimulus like predator, yes, typically from evolutionary approach, or something inner, like our cognitions, that can affect our behavior. In this case, we can have two great approaches, or conceptualizations of emotions, let's say. First, we can say that emotion is a point in a multi-dimensional space with two great axes, like valeness and activation. This approach is derived from theories of activation, from studies of consciousness, of psychiatry, for example, of first physiology, like physiology of higher nervous activity, Soviet approach as well. So all our activity can be scaled as a, let's say, as a type of how we call it, excitation, yes, or activation, like coma, sleep, drowsiness. And emotion is one of these one of this level, yes, the level of activation. So emotion is something like between between stress, very, very great activities, and just normal, how we call it, бодрствование, vigilance, yes, I guess, between vigilance and stress, yes. But in the same case, this type of activation, emotional activation, can be positive or negative, or pleasant or unpleasant. So in this case, pleasant or positive emotions can guide us to approach, and negative, unpleasant emotions will lead to avoidance. Yes. In this case, emotion can have a very important evolutionary role. It helped us always to survive in some way. This approach is very quantitative. Let's say that each emotional state can be scaled as pleasant or unpleasant using a scale from -4 to 4, for example. It's more or less typical in modern studies, and a level of activation from 0 to 5, for example. I used especially from 1 to 9, for example. And once again, emotions reward or punish us, or in other words, emotions are a type of reward or a type of punishment. Once again, a stimulus can be very positive, pleasant. Yes, in this case, we should approach to it. And if we get it, it's a reward for us, a pleasant emotion we experience. In the case of punishment, it's on the contrary. We avoid or we destroy the object if possible, in order to avoid the punishment from it. The second approach will be called the basic or discrete or differential emotions. It also has an evolutionary background from Charles Darwin, who first described these basic emotions like anger, disgust, fear, happiness, sadness, surprise. Some researchers propose more emotions, but more or less the cross-cultural approach of Paul Ekman showed that the most reliable classification comprises of these six basic emotions. This one is more qualitative. It's more typological because it's very difficult to catch the combinations, because in reality we don't experience a very prominent anger or disgust. In reality, we have always combinations of this. That's why it's more typological. So in each case should be classified as disgust, for example, or sadness, but it's not so easy for subjects to understand it, and it's very difficult for psychophysiologists to measure these emotions. I will show you later the advantages and disadvantages of each approach. And yes, maybe the unique measurement we can have for this approach is a facial expression research, be it from video camera, as I will show you later, be it from electromyography of face, which is very reliable indeed. So let's conclude. There are two types of classifications of emotions. First, we can describe any emotion as pleasant or unpleasant with a certain level of arousal, activation, excitation. And at the same time, each emotion can be qualified as a basic emotion, like anger, fear, disgust, etc., or a combination of them. These approaches use different physiological equipment, and we will discuss it later. So let's begin with the dimensional approach, which supposes that the emotions are points in this in several scales. In this graph, you can see two axes. Yes, the valence or pleasantness. So each emotion can be pleasant and unpleasant, and at the same time, each emotion can be strong or weak. You can see here the U curve, like Latin letter. So it means that very pleasant or very unpleasant emotions at the same time has a very greater arousal activation. Here you can see some typical stimuli that are used in emotional studies, like mutilations are very reliable negative stimulus, or violence. As pleasant stimuli, we typically use families, erotica, children. Food is less pleasant, and nature, for example, is even more neutral, something like this. We also have in these databases of pictures a lot of neutral pictures as a control, yes? So, for example, a very systematic, let's say, study would comprise of very pleasant, very unpleasant, and neutral stimuli to understand easily the emotional state of the subject. Okay, let's begin with facial electromyography of emotions. It's a method we routinely use here in the great majority of studies. We also can use it with EEG as well, because typically the same equipment has not only EEG, but electromyographical sensors. Face of people comprises of a lot of muscles, but all these muscles generate different emotions. If we are in the dimensional approach, we divide all emotions into unpleasant, and we easily can measure them from corrugator supercilii major muscle, which is in the brow. So we put 2 electrodes here. We need always 2 because we measure the difference in the electric potential. To study pleasant emotions, it's very easy to put electrodes on the cheek, where zygomaticus major muscle is located. Here in this graph, you can see very old examples of corrugator supercilii activation. So you can see that in response to negative pictures, yes, this muscle is aroused. In these paradigms, we typically present stimuli during several seconds because, as we said, the easiest way to measure emotions is to capture the reaction to a short and let's say clear stimuli. Pictures are much more preferred, for example, in comparison to videos, because a picture like mutilation, yes, can easily provoke exactly one emotion, and we can capture it during this 6 seconds. So you can see that about the and here below you can see the activation of zygomaticus major muscle in response to pleasant picture. So you can see that more or less from the second 2, we can see a significant difference in the activation of these muscles in response to appropriate stimulus. We do it routinely, and let's say it works in 95%, something like this. If you correctly select stimuli, of course. If you select very unpleasant or very pleasant stimuli, it works very well. Of course, when you have several subjects and several repetitions, of course. Here we present some additional data from our studies, where we divided our subjects depending on empathy, and we show that only people with high empathy in reality display this pattern. So in their case, unpleasant pictures, yes, did evoke the corrugator activity, frowning of the brow, in respect with neutral and pleasant pictures. People with low empathy did not display this pattern. And if we compare people with low empathy and high empathy, people with high empathy presented significantly greater frowning of the brow, the activation of corrugator. It leads to a very unpleasant situation. It means that we need we need to equalize our participants depending on empathy, let's say, because if we recruit only people with low empathy, maybe they are not good to be studied if we need to study emotions. Another index of valence of pleasantness of stimuli will be start blink reflex. Is the activation of orbicularis oculi muscle, which is below the eye. It reflects the blinks. The paradigm consists in presenting sudden loud noises. People typically blink when they hear these sudden sounds. Sudden sounds. But in the same time, if these sounds are emotional, or we, for example, simultaneously present pictures with different emotional valence, we can see this difference. I saw it as well, but this paradigm I don't like typically, but I proved it as well. And so people blink with a greater amplitude or magnitude when this sound is unpleasant. So a lot of studies already showed the same pattern. When we face some pleasant stimuli, our blinks are not so great. Evolutionary speaking, maybe it means that we should be more prepared to unpleasant stimuli, something like this. We will speak a little bit about negativity bias later, which in general says that our negative emotions are more prominent than our pleasant emotions. And the majority of these indexes show the same. We also conducted some studies with motion analysis, because when our sympathetic nervous system begins to be activated, it also affects our muscles of posture. So this can be measured with the so-called posturograph, yes, or force plate in English-speaking countries. We have it here in our institute as well. And we measure the sway, the balance, or scientifically speaking, center of pressure position, let's say. So the patient or subject is staying on the platform, and we can present visual or audio stimuli to them. Here you can see the final graph, let's say, how the posture changed during a period. Here the paradigm supposes at least 1 minute, if I remember well, of the presentation, because posture is very slow to respond to emotional state. But still, here you can see an example of the dynamics of posture in both axes, in X and in Y. Yes, in this case, X is gray. No, sorry, Y is in gray. Yes, so anterior posterior sway is greater always. So we incline towards we incline forward or back more than in medial lateral axis. And we showed also that unpleasant pictures provoke a greater sway, and the speed of this sway is greater. So the interpretation is more or less the same, that unpleasant pictures require stronger and faster movement, something like they prepare us, yes, to fight or fight, to flee or fly. Sorry, to flee or fight. It's the typical proverb, yes, from evolutionary scientists. Another technique is temperature. There are several methods of temperature measurements. We can see the measurement from fingers, from electrodes from the face as well. But the new technique which we used is functional infrared thermal imaging. It comprises of a very sensitive infrared camera, like the camera of night vision. Yes, it's more or less the same like our modern thermometers. It can distantly measure our temperature. And here you can see a graph from our study. So we presented here, I don't remember, maybe unpleasant stimuli. So you can see that during the stimulus onset, the temperature very, very slowly begins to decrease. Here we used stimuli of, let me remember, of 1 minute, I guess, 1 minute second. Yes, 1 minute, 60 seconds. Yes, here you can see it here, because this response is very slow. But still, after the decrease, then the temperature begins to increase. Then we presented here another stimulus. And if you can see, yes, we also show the decrease, and then temperature begins to recover. Let's see the scale. As you see, the temperature is not 36, of course, because the camera can be posed in 1 meter, for example. And when the infrared light comes, the temperature begins to get down. But still, a possible implication, practical implication of this method would be the covered measurement of people in crowds. Some countries began this method to use in airports, if I remember well, in jails as well, to more or less understand if the variability of temperature of people as indicators of emotions. They try to control situations when people experience panic, for example, yes, if we speak about airports. And yes, yes, it's the zoom of the same graph of the temperature. Yes, here you can see already the change of the temperature. Yes, and during stimulus onset, no, sorry, the stimulus lasted 1.5 minutes. So you can see here the decrease and then the recover of the amplitude. And as you see, the latency is super great. So this method is not very comfortable to use. But still, we saw differences between unpleasant, neutral, unpleasant emotion, amplitude, yes, emotion, sorry, in amplitude, and the same for latency. So pleasant and unpleasant emotions decrease the temperature, and they do it shortly. So yes, they look, the temperature needs 1 minute to begin to change. But a more appropriate method of measuring emotions is heart rate. Maybe you already used it in your practice. You can have several methods of measuring it, from photoplethysmograph, like here. This apparatus emits light. It goes through the finger and reflects back. This way we can understand the volume of the blood in the finger, and from it, yes, is this curve you can see. So when we have more blood here, we can see the peaks, and from these peaks we can measure the heart rate. A more reliable method, of course, is electrocardiography, which capture the electricity from the wrist, for example, yes. But still, there are no much difference. For psychological experiments, you don't need the medical electrocardiography from the from the chest. Yes, you need only the peaks, RR peaks. Yes, from these peaks you can derive the heart rate. Here you can see a typical dynamics of heart rate during, let's see, 20 more maybe seconds. Yes, so I guess here is the second zero. Yes, here we present the stimulus. After it, during several seconds, here I hope you can see the lines. Yes, during several 3 or 5 seconds, we can see the deceleration. So hearts begin to work slower. Let's say in the scientific jargon, we call it freezing. Yes, so the heart stops, in brackets, of course. So first it decelerates, but then it accelerates during next, let's say, 5 seconds, more or less. So more or less 5 seconds to deceleration and 5 seconds for acceleration. If you persist the stimulus, the heart can go greater and greater and greater, and then your heart will work with a very great velocity. In this case, I guess the stimulus was switched off, and that's why the heart rate begins to decrease. Heart rate is also the marker of arousal. So both unpleasant and pleasant stimuli freeze the heart, decelerate the heart. Let's say an interpretation could be that maybe you remember Theodore Ribot, very old French scientist. He studied it as well, and he said that this deceleration could mean a great rotation of the brain, something like this. So our sympathetic system goes down because the brain should perceive the situation, let's say. But then when we understand that the situation requires our reactions, the heart begins to work with a greater amplitude because we need to react some way. Flight or fight reaction maybe is required. This curve was studied by Pavlov. He called it cascade, heart cascade, cardiac cascade, yes, as a method of measuring emotional or stress reactions. Another method of heart measurement would be variability of heart rate variability, HRV, which is more or less the standard deviation of the heart rate. How can it be interpreted? It's a very nice index of very great stress and of flexibility or adaptation of subjects. Typically, if you experience an emotion, first the heart decelerates, then accelerates. But if everything then is interpreted and you responded somehow to the situation, you solved it, the heart begins to decrease. But in the chronic stress, the heart rate stays very high. And if the heart rate is high and the reliability, the standard deviation is high, is lower, yes, in the opposite, yes. So if you always in the level of very great heart rate, it means that the variability is low. It means that your heart cannot respond appropriately to the stimulus, to the situation. which can later lead to some cardiac problems. I suppose you know these psychosomatic studies, yes, that shows that heart is a very sensitive to stress reactions. I mean, the cardiac health. People who experience stress have a greater risk of cardiac disease because the heart cannot be relaxed, lamentably. And this index is very popular among psychotherapists who use these relaxation methods, like meditation, for example, or biofeedback. In biofeedback machines, heart rate is always in because it's easy to interpret heart rate and heart rate variability. It's used also in organizational psychology when they prepare personnel to police or to army, for example. Yes, because they always are in a stress situation and they should cope with it. And heart rate by a feedback machine are used to in these trainings. Another very cheap and very reliable method to measure arousal is skin conductance. During any emotional activation or arousal, our sweat glands begin to be more activated, which leads to greater sweat secretion. In sweat, we have a greater concentration of ions, of metals, which leads to greater conductance, skin conductance. These cables can measure it, and in the graphs we can see typical peaks. Each peak means a case of arousal. Like here, we can see four emotional situations, two of which is the greatest. This is the method of measuring arousal once again. So you cannot understand the valence of the stimulus. Be it unpleasant or pleasant, you will see the greater skin conductance. It's a very old technique. It was known from the beginning of the 20th century, and still it's very popular because it's cheap and can be used in the very different wearable devices. It also used in organizational psychology to control the emotional arousal of workers. Let me show you some practical implications of this method. Here you can see a study of advertisement, of marketing. They presented several goods, and they wanted to understand which good can be more successful in the market. So in this pre-test of goods, they showed the different pictures and asked people to choose or not to choose after the experiment if they would like to have it. It was cosmetics, and we can see very great difference in skin conductance between preferred and unpreferred items. So more or less, marketing people begin to use psychophysiological equipment as well. Another study also about advertisement presented unpacked food, food in the package of favorite brands of subjects individually, and family and friends of these subjects, of course, individually, because as I said first, family and friends are more or less the most pleasant stimuli for us. And we can see here that there were no difference in skin conductance or arousal between pictures of friends and food in the favorite packages. but the same food unpacked without the package provoked a much smaller activation of skin conductance. Let me show a little bit about our new study about coping or emotion regulation. It's our new topic. We see how people can use different strategies of coping or emotion regulation, and how it can be represented in psychophysiological data variables. We use skin conductance or electrodermal or skin galvanic, it's all the same measurement. We use heart rate deceleration or freezing, and we use corrugator as well as the index of negative emotions. So we presented different unpleasant pictures. We used mutilations, violence, and so on. And we asked people to use different strategies of emotion regulation. There are several theories of and classifications of emotion regulation or coping. Two most popular types would be called suppression, when we try to hide our emotions. Let's say we try not to use mimic muscles, we try to breathe slowly. Another strategy is called reappraisal, when we use our cognitive resources to reappraise or rephrase or reinterpret the situation we are watching. For example, like if you see mutilation, you can imagine that you are a doctor and you should not be in a panic. You should help the patient, like typically doctors do. Yes, it would be called reappraisal. So in our case, we saw that even when skin galvanic response between suppression and reappraisal, and the corrugator response between suppression and the reappraisal are the same. In heart rate, we see a much greater activation or deceleration, yes, in response to suppression. And here we refer to the theories, once again, of the relationship between heart problems and the stress or bad coping, which says that even when we try to suppress our emotions, and we do it effectively, let's say we suppress and our emotion more or less, we suppose that it stops. Our heart works with a greater amplitude. Let's say it decreases its rate. Let's say our heart resources can stop our emotion, but it will lead to several heart problems. Okay, I see the question. I will answer to it. Let me check the watch. Okay. The continuation of this study is dividing our subjects to empathy levels, and we are finalizing the recruitment of subjects in it. And we see, like in our previous studies, that empathic people are much more emotional, like we of course know from previous studies. But this difference, depending on regulation, we saw only in high empathic people. So once again, it seems like low empathic people did not differentiate nor emotions nor emotional regulation strategies. So first, methodic consequences would lie in the fact that we maybe should equalize people depending on empathy, or maybe recruit only high empathic people, depending on the purpose of the study. And first, very important for applied psychology conclusion is that high empathy people, even when they try to regulate their emotions, you can see it here, suppression and reappraisal, they still cannot decrease their emotions to the level of neutral state. So they are very emotional. Yes, they do regulate themselves, but not to the baseline, something like this. The practical implication may be that we should pay more attention to these people when we speak about psychological counseling or recruitment and so on. And okay, let me go faster. Our last study, here we used all these methods: electrodermal activity, corrugator, and we also used automatic recognition of emotions. I will speak about it in brief, to predict the level of donations to funds, charity funds, during this economic game. People donated, our subjects donated to different funds, which presented pictures of their pets, animals, and we measure all these activity, and we show here, for example, you can see the graph of corrugator. So the more activity of corrugator we saw, the greater donations a picture received. We also understood that sick animals received more donations than healthy. It has its practical value, because right now in marketing advertisement sphere, they argue which emotion we should evoke in order to have more donations or to sell more goods, because typically in the market they thought that shocking advertisement is better because it capture more emotion, because it's remembered well and so on, but it also can traumatize, yes, the watchers. That's why right now they begin to make their advertisement more tender, let's say, yes, more pleasant. And some funds, for example, we spoke with them, begin to use pictures of very well cared dogs instead of very poor dogs like they always did. So at least our study and some other studies showed that no, we still should shock our people to attract their attentions to our products or our funds and so on. Still the response the same. As to automatic recognition, yes, I will speak about it right now. It's not exactly the vegetative method, but still. Okay, it's exactly the response to the question. So how we can measure valence and arousal? So the best method to measure valence is facial electromyography. When we put pairs of electrodes to muscles we need to study. To study unpleasant emotions, the best way is to measure corrugator supercilii major muscle, which is in the brow. To study pleasant emotions, it's easy to measure zygomaticus major muscle from the cheek. A startle blink is always used, but it's a very narrow paradigm, let's say, when you need to startle your participants. You can use several electroencephalographical components that we did not discuss right now, and we see that motion is also can be used, but still it's let's say its use is still narrow. So the best way, I would say, it's electromyography. We routinely measure it, and more or less always it works, at least in grand averages, let's say. Yes, when we average several participants in several conditions, in several iterations, sorry. All the rest measures are good to identify the arousal, the activation, sympathetic activation of the participants. Electrodermal activity is the easiest and cheapest one. Right now, it's in all the equipment for biofeedback, for example, for relaxation cabinets, something like this, because it's calculated very easily. Electrocardiography is good as well, but still it needs more processing, let's say. Facial thermography, maybe it's new and very perspective method, but still it's very, very expensive. In the EEG, we also can easily measure arousal, but of course it's much more tedious as well. And let's briefly speak about basic emotions and how they are measured in psychophysiology. Basic emotions are 6 emotions that are culturally universal. It's fear, angry, sad, happy, disgust, and surprise. So people from jungles and people from skyscrapers have these 6 emotions. They are expressed in the same way, in response to the same stimuli, and so on. And all other emotions like shame, like Schadenfreude, like envy, for example, are either combinations of these 6 emotions, or like, let's say, nuances, or maybe just another titles for the same emotions in different situations. For example, like shame can be sadness because of our mistakes, so our social mistakes, for example. Rage is just very great level of angry, and so on. For example, contempt is disgust towards people. Okay, just one word about neural correlates of basic emotions. All of them are studied more or less well. There are several structures like amygdala, very well known, for example, yes, or nucleus accumbens. Nucleus accumbens is more or less about pleasant emotions like happiness. Amygdala is responsible for rage and fear, and so on. Neurochemistry of emotions is very promising field as well, but not in the scope of our lecture. Okay, facial electromyography here is the best method as well. But if you would like to study all basic emotions like disgust or surprise, you need much more electrodes. In my picture here, I didn't put, sorry, all the electrodes you need to study all basic emotions. For example, to study, we spoke about, yes, corrugator, we spoke about zygomaticus, but here you still need to, for example, orbicularis. You can also hear depressor labii, I guess this is a muscle, to study sadness. So more or less to study a specific basic emotion like sadness, for example, you need a combination of several pairs of electromyographical sensors. Yes, and yes, and of course people do it. Once again, let's speak about corrugator and zygomaticus because they are the best solution, let's say. And here you can see the results of a study which show that imitation is automatic. Here they presented to participants faces of other people in different emotional states. So when the subjects watched angry and happy faces, they automatically imitate them. So when they watched happy faces, their zygomaticus muscles were activated. And on the contrary, when they watched angry faces, their corrugator muscles were activated. You can see that sometimes muscles are sensitive to all stimuli. Like here, you can see, yes, very sudden and very great response to both stimuli in corrugator. But then about 1 second, you can see the strong difference between reactions to angry and happy faces. Okay, and in the end, let me show the another way to understand the peripheral activation of emotions, but in a very different way. Here we didn't measure any physiology, but we tried to stop it. It's an old method, but we changed it a little bit. We comprised more faces, so we presented a lot of faces with different level of expression, let's say. For example, here in this woman, it's a morph between happiness and maybe semi-happiness, something like this. But what we did, we restricted their mimicry. It's a very easy way. If you apply a very strong plaster to different muscles, you can try to stop the automatic imitation. So now people try to use it in different regions of the face. In the very, very strict cases, they even try to anesthetize and you use anesthesia to stop muscles. In our case, we just use the plaster and we use the stick in the mouse to stop automatic smiling. And yes, here we presented these morphs. We use different tasks like indicate when you see fear, or in another case, we asked people to indicate what emotion they can see, like here. Here, from disgust to fear, you can see that the dynamics. Yes, and exactly in this case, people should indicate when fear begins. In other type of trials, they should indicate when a new emotion begins and indicate which emotion begins. So in this hypothesis, we try to understand whether this restriction of imitation can provoke a worse recognition. Yes, and we saw here that people with low empathy begin to work worse when we stop their imitation. Yes, they begin to recognize emotions just in 73% of expression. People with high empathy could recognize emotions earlier, but in our case, the muscle restriction didn't work. In a lot of articles, it worked. In our study, it didn't work, and maybe here the future direction should be elaboration of a much more strict method of imitation restriction, like, as I said, anesthesia or something like this. There are some new studies about Botox injection. Some people inject Botox, yes, in their faces, and it leads to the problems in first imitation and then in recognition of emotions. They begin to experience impairments in emotion recognition because they cannot imitate to faces they watch. Okay, and the last slide would be the theoretical conclusion, let's say, of the mixture of these types of approaches. Yes, it's from Russell. It's something like the the mixture of two approaches. You can have two axes like valence and arousal, and still each basic emotion and their nuances can be sorted in a specific place of this graph. So if you need to study a specific emotion or a level of valence or activation, you should use a specific method of vegetative or somatic registration. And you need to have a very nice, very pre-selected stimuli to be able to provoke a special emotion. All right, if you have questions, yes, I guess, yes, we have 15 minutes.
Okay, thank you very much. We can stop recording and we can switch to Russian.
Хорошо.